So Fruquintinib is currently FDA approved in the third line or greater setting for patients that have been previously exposed to fluoropyrimidine, oxaliplatin, and irinotecan-based therapy, as well as anti-VEGF therapy, if appropriate, and also anti-EGFR therapy if RAS wild type. The purpose of the clinical trial was to demonstrate improved overall survival, and the FDA indication is actually based upon 2 phase 3 clinical trials that have been conducted, one in China and one outside of China, which included international sites. And the original phase 3 trial in China was specific for at least 2 prior lines of therapy, but it did not require prior VEGF therapy or prior EGFR therapy. So in fact, 60% of patients had not received a biologic in addition to their chemotherapy. And the purpose of FRESCO-2 was basically to kind of validate the earlier findings, but also to allow enrollment for patients at multiple sites outside of China. So it's an international study. It's a 2-to-1 randomization of Fruquintinib, which is 5 milligrams daily, 3 weeks on and 1 week off, versus placebo. And the primary endpoint was overall survival as well. The one thing that was different about FRESCO-2 is that patients very similar had to be exposed to fluoropyrimidine, oxaliplatin, irinotecan, anti-VEGF therapy, and anti-EGFR therapy if appropriate. But they could have been exposed to TAS-102 and or Regorafenib. So in fact, greater than 50% of patients had received TAS-102 in the past, and about 40% of patients had received TAS-102 and Regorafenib in the past. And the median lines of prior therapy was 4, and the primary endpoint was also fulfilled in this clinical trial, which is more representative of practice patterns of providing anti-VEGF therapy in the frontline setting. And the OS was superior with a hazard ratio of 0.66, meaning that is a 34% increased likelihood of improved overall survival with the use of Fruquintinib versus placebo. And in fact, the PFS was also superior for Fruquintinib with a hazard ratio of 0.321. So all in favor of Fruquintinib versus placebo in the refractory setting. So because of FRESCO and FRESCO-2, the FDA took the data and allowed a third line plus setting for this indication, which means that we are also competing, not necessarily competing, once again, we're providing options to our patients in the third line setting with Regorafenib, TAS-102 plus bevacizumab, and now Fruquintinib. And I should mention the mechanism of action. It's a selective inhibitor of VEGF receptors 1, 2, and 3, which makes it unique versus Regorafenib, which is a multi-targeted tyrosine kinase inhibitor, and also versus bevacizumab, which binds the VEGF-A ligand. So